Namaste. I'm Dr. Malati Panchwag, perioperative physician at the Center of Excellence for MVD Surgery here at Pune. Have you heard of people who suffer from terrible facial pain with even a small breeze or a light touch of the face? Or people whose eyes and face keep twitching without control? These are not just stress or dental issues. They could be signs of cranial nerve hyperactivity disorders. So today, I'll explain three of the most troubling ones: trigeminal neuralgia, hemifacial spasm, and glossopharyngeal neuralgia. Let's understand what they are, why they happen, and how we treat them, especially with surgery that can change lives. So what are cranial nerve hyperactivity disorders? Our brain connects to different parts of the head and neck through nerves. We call them cranial nerves. Sometimes these nerves become overactive due to pressure from nearby blood vessels, and that leads to severe face or throat pain or muscle spasms in the face. These are called cranial nerve hyperactivity disorders. Let's start with trigeminal neuralgia. This causes sharp electric shock-like pain in the face, especially while brushing, eating, shaving, or even talking. Many people first go to the dentist, but the real problem is with the trigeminal nerve, which carries sensation from the face to the brain. Next is hemifacial spasm. This usually starts as eye twitching or cheek twitching, or as it progresses, it can involve the entire side of the face and spreads down into the neck. This is caused when the facial nerve gets pressed by a blood vessel. Lastly, glossopharyngeal neuralgia is a rare but very painful condition. People feel stabbing pain in the throat, back of the tongue, or even deep inside the ear, especially while swallowing or speaking. The pain can go from the ear down to the throat, or from the throat down to up to the ear. This comes from irritation of the glossopharyngeal nerve. Why do these disorders happen? The most common reason is this: a small artery inside the brain starts touching or pressing one of the nerves, the fifth, the seventh, or the ninth. Over time, the covering of the nerve wears down and it starts firing off pain signals, even when it should not. We usually confirm this contact of the nerve and the blood vessel with a high quality MRI scan, which helps us see the blood vessels pressing on the nerves. Remember, I said a small blood vessel. Sometimes it could be one, it could be many, it could be a big blood vessel, it could be multiple vessels, or something other than a blood vessel as well. But these are not all that common. How do we treat these conditions? In the early stages, we start with medicines. Trigeminal neuralgia and glossopharyngeal neuralgia initially respond to drugs like carbamazepine, gabapentin, or baclofen. But after some time, medicines may stop working, or patients may face strong side effects like dizziness or sleepiness or loss of balance while walking, or even memory issues. Hemifacial spasm is sometimes treated by some doctors with medicines or Botox injections, but these are minimally effective, temporary, and do not treat the root cause of the problem, which is actually nerve compression. Many people give it up out of frustration or due to the need to take repeated injections or other side effects like a stiff face. That's when we look at long-term options like MVD or microvascular decompression surgery. It is the most effective and successful treatment across all three conditions: trigeminal neuralgia, hemifacial spasm, and glossopharyngeal neuralgia. The core principle of the surgery remains the same: to relieve pressure on the nerve by moving away the compressing blood vessel and placing a soft cushion in between. The only difference is the nerve involved. The fifth nerve in trigeminal neuralgia, the seventh nerve in hemifacial spasm, and the ninth nerve in glossopharyngeal neuralgia. There are also non-surgical treatments available for these hyperactivity disorders like gamma knife radiosurgery or radiofrequency ablation, which are mainly used for trigeminal neuralgia. But for the right patient, MVD is the most complete and long-lasting solution. Surgery is not a magic wand, but for many, it feels nothing short of a miracle, bringing them back to a normal pain-free life. So what exactly do we do during MVD surgery? Even though the nerve may differ in trigeminal, facial, or glossopharyngeal disorders, the goal is always the same: to gently move the offending blood vessel off the nerve and place a soft Teflon cushion to prevent it from touching the nerve again. When done with precision and care, this surgery can truly restore the quality of life, free from pain, free from spasms, depending on the condition. Many of my patients tell me that surgery was the turning point in their lives and they're so happy to get their life back. So when should you see a neurosurgeon? If you or someone you know has sudden shooting facial pain or one-sided facial twitching and it's not improving with medication, please don't ignore it. These problems are not just nerve issues. They affect confidence, daily routine, interpersonal relationships, and even mental health. And while the idea of brain surgery can feel scary, the reality is, in experienced hands, the risks can be very well controlled. You must do your research before making your decision. And that's why choosing a neurosurgeon who has handled many of these exact cases is so important. We've treated hundreds and thousands of patients with these disorders, and thanks to our dedicated and experienced team, we have been able to create a truly significant impact in the lives of many thousands of patients who have been treated under our care. Facial pain or facial twitching may seem like small problems at first, but for those who suffer from them, they are life-altering. And the good news, these conditions are treatable, and you don't have to live in pain forever. So stay informed and empower yourself with reliable medical knowledge, and follow our channel for more such videos and share with those who may benefit. We have plenty of videos on trigeminal neuralgia, hemifacial spasm, glossopharyngeal neuralgia, brain tumor, spine problems, spine tumors, etc. Do watch any of these to get more information. Thank you and Jai Hind.